I'm Catherine Thompson, Technology Analyst at Edison, and I'm here today with Andy Thorburn, CEO of EMIS, to discuss the company's full year 2020 results. Hi, Andy.
Hi, how are you?
Great, thanks. Could you kick us off by talking us through the highlights of the results?
Sure. The highlights are actually many, and this year I want to start with the heroes of the day, which is our customers. You know, the NHS have done an outstanding job looking after us. Community pharmacy, the healthcare community, and our partners, and they've just done an outstanding job, and they're the heroes of the hour. Quite fantastic. We've been fortunate enough to be talking with frontline colleagues across CCGs, across acute trusts, NHSX, NHS Digital, NHS England, every day, multiple times through the whole period, and they have just done a brilliant job to support the nation through the various lockdowns, the challenge at the start, and now a very successful immunisation programme underway. So the first highlight is our customers and everyone involved in the response. That is highlight number one. Highlight number two is our team. I said to them in our internal conversation, they stood tall, and they did. We are in a privileged position to serve our customers. We are mission critical to the UK infrastructure from a clinical perspective. Our systems stayed up. We were available. Our people worked literally night and day to respond, to get ahead of the COVID challenge, get the systems ready, and to respond to any issues or challenges or thoughts coming from many parts of NHS. And especially in the early days, as you would understand, there was lots of different signals coming out of different parts of NHS as everyone scrambled to do the right thing. So our team, we formed a special team to support, and that was led by our Chief Medical Officer, Sean O'Hanlon, and Ian Bailey, one of our senior clinical representatives. Brilliant. You know, they just did an outstanding job. The other thing is that internally, we had some amazing work from two particular groups I want to call out, apart from the whole team. One is our mental health first aiders. So we had a mental health first aid program put in place some time ago from the ground up, 20 volunteers. We also trained another 8 at the start of the year. So we had 28 mental health first aiders helping our teams when they moved to home, and they did a brilliant job. And in fact, we just acknowledged them in our annual awards as the top team, along with our HR professionals, who did an amazing job supporting our teams at home. We moved the whole company to home about 2 weeks before any other company in the UK, because we didn't want people getting sick, so protect our colleagues. And when you're not sick, you can look after your customers. So we made those early decisions. And we had a mantra. We decided as an exec team in February that we would live by, do the right thing by customers and colleagues all time, and to put in family-friendly policies to support everyone managing their families at home because children couldn't go to grands and grandpas, etc. So that's social conscience for the group, which is a part of what we do, all came to the focus for the year. And as the CEO of this business, I couldn't ask anyone to do any more. I wouldn't change a single thing. And there's not often people can say that. And then finally, we as an exec team were determined not to go backwards in our financial results for our shareholders. And a year ago to the day, we called out what we thought our forecast would look like based on the conditions, on the worst day of trading, I think, in the difficult trading times. And the team committed not to go backwards and to deliver a set of results that we have. While not spectacular in growth, they represent the best of the company. So lots of highlights and a great year for EMIS, the best year of execution since I've been here. And we're delighted to support the NHS and all of our customers and partners through the challenges of COVID.
And could you talk us through a bit more detail on a divisional basis?
Sure. Divisional basis, game of two halves, really, just being honest. We went forward in EMIS Health because clearly NHS had new demands. Lots of things had to be put in place at short notice, more flexible working packages. We actually pivoted our product approach to provide those flexible environments for GPs working at home, video consultations, remote consultations, those type of things. So our mix of product changed, and we actually had a lot of hardware go through the books this time, which is not normal for us, but was what the customers needed. And in the devices we shipped, we had special secure software to allow our clinicians, whether on the go, at home, to access patient records securely with the full protection of both the NHS backbone security, but also the EMIS security. So that's what really drove the hardware adoption. And so we went forward positively with EMIS Health. On the EMIS Enterprise stuff side, I beg your pardon, we business stopped for a major part of that for about 4 or 5 months. So community pharmacies saw very few people come through the door. Some of the initiatives we've got connecting our digital world with our community pharmacy world went on hold because people were just obviously not going into pharmacies unless it was an emergency. And therefore, a lot of the initiatives we had there went on hold. So we were very strong with health and we were weaker with enterprise, which is completely understandable from my perspective. That doesn't mean the enterprise team weren't working hard. And in fact, we stood down our whole sales force in May and June to make sure they became service reps, because selling was not important. Supporting was the right thing to do. And we didn't go looking for sales. We didn't go looking for new business. It was inappropriate. So we stood them down and said, please phone your customers and ask if they need help, and let's give them the right support. So again, overall results good, but yeah, definitely two halves, health forward, enterprise, unfortunately, a bit on hold. We also had a strong comparative the previous year in enterprise, to be fair. So we did a very strong year the previous year. But we expect things to normalise as we move through this year.
And I saw that product that you bought last year, Outcomes for Health, which was part of Pinnacle Systems, is currently being used for the vaccination rollouts nationwide. Could you give us a bit of an update on that?
Yeah, interesting. We bought Pinnacle. I think we classed it as a small bolt-on acquisition as part of our pharmacy portfolio that we're building. And we didn't give it too much headline. Its core job is clinical commissioning, managing that process, making sure the audits are there, making sure that everything's reconciled. And we've got an excellent team that we brought on board. What was very interesting, though, is the immunization program came on the horizon. There was a need to have a system to manage everything outside the hospitals. And our team stood up, presented directly to the Secretary of State and the senior management team. And we have been the only provider in the immunization program taking and recording those results real time. About 1,400 locations now, immunization centres using Pinnacle. And the last time I looked, we processed, I think, 14.9 million vaccinations in the period. Our system availability, 99.99, probably another couple of nines, to be honest. A brilliant performance. And also the pivot meant a complete rescaling of this application. It wasn't designed for this volume. And we've now got a system designed to manage 200,000 vaccinations an hour. And I can tell you, I've got a dashboard that appears every hour. I can tell you how many vaccinations were undertaken in England in the last hour. And that's a testament again to the team. It's a testament to our colleagues in NHS Digital who have worked with us to get this live, to help manage the integration of other NHS systems, meeting twice a day, true collaboration with customers. And again, part of our social responsibility is we're at the heart of probably the biggest social program in the UK for many, many years, which is freeing people up from lockdown through immunisation and also testing. So we, in parallel, we're running a major testing recording process with one of our other products in our order comms area. So we're the heart of immunisation testing in England, and the team have done an outstanding job. And so that little Pinnacle acquisition suddenly became very important to us. And Gary and Kevin, the founders who are with us still, and the team have done just a brilliant job, and my hat goes off to them, just outstanding.
And could you talk us through the progress you've made with EMIS X and also any other new product developments?
Sure. So meanwhile, with all the COVID response going on, the special teams, the Pinnacle, the system adaptation, we have continued to execute our EMIS X strategy. And that is about bringing all of the disparate elements of our business into a coherent strategy and a coherent platform. That's gone, again, very well. We've advanced our digital capability, and we launched our EMIS X analytics capability, which was early and is big in this COVID world, where the ability to understand cohorts of patients, to understand who's at risk, to have a 360 approach to identify them and bring them into the GP workflow, to bring them in if they're at risk, and then give them, whether it be medicine or procedures. Very important, linking that in with clinical research. So EMIS X Analytics is really moving forward. We've got lots of trials with NHS. We've got a couple of big customers in the life sciences area, which we're really starting to focus on. We see that world of healthcare and life science coming together. That's been super. And then, so digital, very important in COVID, analytics, and then connected care, which is what the group's all about. And that's what EMIS X is about. Our foundation modules or shared capabilities are moving on well. We've been really smart how we're doing that. And also we've reduced execution risk by partnering much more. So we're taking capabilities from big partners who've got massive R&D budgets. That might be AWS, it might be Microsoft, it could be Salesforce. And that's accelerating EMIS X and reducing execution risk. So we've had a bit of a move forward in the partnering front. COVID also educated us in things that the market needs quickly, and we've adapted our strategy and continued to execute well. So again, super progress considering all of the distractions. Understandable, we had to look after customers in COVID and patients, most important, but good progress, and we're pleased with that. We'll continue to invest this year, and then we expect to start seeing some interesting returns on that later on this year, but as we move to 22-23 and beyond.
I see Matt Hancock has announced another NHS reorganisation, so this time looking to bring together health and social care. How do you think that will impact EMIS?
So the integration of health and social care and the white paper, I think, plays exactly to what we considered would happen, not the exact model per se, but integrated care or connected care is just vital. And I think the Secretary of State, the Prime Minister, the senior folks in the NHS have recognised the need for joined upness through COVID. It is very clear the more data you've got going across settings, the more focus you've got on the patient journey, the better ability you've got to be able to work with people at home and not necessarily bring them into a facility, but have test results, have appointments booked, have repeat medicines. All those things, I think, are recognised by the authorities, by our customers. And we've been on the journey. And when you think about our three big investment areas, digital, analytics, and our care platform, which is EMIS X, is our shorthand for all of those things. I think we've made good decisions. We didn't know COVID was going to happen, but I think we've made good decisions. I think we're very well placed to do the right thing by our customers in this emerging post-COVID world. And while COVID will be, at my view, will be around us with regular vaccinations, etc., we will return, I think, to a freer life where we can move around. And I think that there's a recognition that the type of things we do and others do, of course, are very important to the future of the healthcare system in the UK. So, yeah, and we're there to support our customers. And as the new world evolves, we'll be there with them. We know lots of people we're very connected, and we want to do the right thing as they look for better, faster, deeper solutions that make the difference to the citizens of the UK.
And finally, could you give us your view on current trading, in particular whether you're seeing any signs of interest in non-COVID work, and also give us your view on the company's longer term outlook?
Sure. So current trading, we've had a good start to the year. We expect to return to growth this year. We're confident of that, and we've got a good pipeline of opportunities, both related to COVID, so obviously things like Pinnacle, which are COVID special, but we've also got new models of care emerging, which you could relate to COVID, but my view is you're going to be in a hybrid world of the physical location and the digital world forever. I think that the world doesn't go back to where it was. I think that technology will be key to the future, and we're seeing those new requirements, while early, coming through. And we talked about life sciences earlier. The business model for life sciences is changing around clinical research. There's going to be virtual clinical research. There's going to be clinical research with people being managed at home, not in a hospital environment. We see all of that, and we're working closely with new customers and new relationships to build solutions there. So the world of COVID has provided, I wouldn't call it opportunity. We've had to change our product mix to serve, and that's what we did last year. We're doing that again, but what it shows is the depth and breadth of the portfolio here at EMIS. We are really relevant in real strategic ways. We just talked about immunization and testing, which is the heart of what's going on, but we're the heart of GP systems across the UK, 57% market share. People on the go, emergency room, or the A&E for those that like to call it that, across almost 12 million people with our app now. Community pharmacy in 5,200 locations. We are a strategic player here, and we see opportunities for us in a regular business emerging now. There'll be some uncertainty. It'll be bumpy, because it will be. The world of COVID recovery hasn't been done before, so we're all kind of guessing and watching and learning, but we're in good shape, so we expect to grow. And then when we look out beyond this year, I think the real good thing is we've always talked about EMIS X and our total investment program being in the midterm. Well, the midterm's coming towards us, so we see more success on the horizon in the coming years. We see that in the new areas we've built, as well as maintaining and growing shares in I'll call our traditional markets. And we're expecting to be within those objectives we outlined at the Capital Markets Day just over 2 years and 3 months ago. It seems a long time in the COVID world, but it's not that far away. And what we said there was, we hope to have revenue in the 5 to 9% area on a consistent basis. And I think we can see that for 22, 23, at the lower end of that, but certainly moving towards that. And also we wanted to expand our margins from then about 23%. We're around about 25% now. And again, as we look forward, we can see that margin expansion from 22, 23, heading towards that 30% and improving from where we stand today. So in the post-COVID world, the current COVID world, and the world that was here before COVID, we've got a plan. We're executing that plan. We are determined to focus on creating value for our shareholders. We're determined to focus on creating value for our customers. And we want our colleagues in the business to enjoy what they do, to really want to work at EMIS and to contribute, which they have done in magnificent form in 2020. So we're in good shape. We never like to say too much about the future, but we're saying just a touch more. Our job post financial results, as ever, we get our head down and we get the work done, and that's what we can continue to do. But I think we're in good shape, and I couldn't be happier with the team, where we stand. And again, hats off to our customers, our partners, and everyone in the pandemic that's done a brilliant job serving the nation.
Great, thanks for the update, Andy, and good to see such a robust set of results despite the year we've had.
Thank you so much. It's been a pleasure to be leading the charge at EMIS, and we hope to continue to improve and look forward to talking to you soon. Thank you so much.